In this video, we will show you how to take an image of the eye. It is important to take a high-quality image so the ophthalmologist can have a clear view of the eye and correctly determine what problem the patient has. Before beginning imaging, clean the phone camera with a sanitary wipe to make sure the device is secure on the phone. Make sure the LED light cord is plugged into the charging port. If you don't clean the camera, images can appear gray and washed out. If the image has streaks of light, you may also need to clean the camera or the lens. Make sure you are at eye level with the patient by sitting across from them or bending to their level. If you aren't taking pictures at the same height as the patient, your photos will show the eye located off-center within the image. This problem makes it more difficult for the doctor to get a clear view of the eye and correctly diagnose the patient's condition. Press the scope firmly against the face so no external light enters. If the image has unusual reflections, this may be because external light is getting into the picture. Make sure the scope is pushed firmly against the face so no outside light is shining in the eye. Make sure the iris is in focus. You may need to move slightly further or closer from the face to get the eye in focus. It is important to push the camera forward enough to get the images that are focused on the iris. A common mistake is failing to push the camera in far enough. In such cases, the image is focused on the patient's eyelid or eyelashes instead of the internal parts of the eye itself. With this common mistake, the internal parts of the eye, such as the cornea, iris, and cataract lens, will be blurry, and the ophthalmologist will have a difficult time determining the patient's diagnosis. Instruct the patient to look at your forehead so the patient's pupil is centered on the imaging screen. When you are satisfied with the eye position and you are ready to take a picture, tell the patient to blink once and then open their eye wide. This helps to clear any extra tears from the eye. Then capture the photo. Now we check if the image is high quality. These are all examples of high quality images. Let's review what makes these images good and specific problems to avoid. First, the eye is fully opened. The eyelid is not drooping or blocking view of the eyeball. Second, the eyeball is located in the center of the photo. The eye is not located in the corner. All parts of the eye are in the photo, and no parts of the eye are cut out of the photo. Third, the eye is pointing straight ahead at the camera. The eye is not looking off to the side. Fourth, the photo is in sharp focus on the internal parts of the eye. The best way to get in-focus photos is to push in enough with the hardware. Before moving on to the next patient, sanitize the scope with a wipe. This is critical to make sure you do not spread eye infection between patients. With practice, you can learn to take images quickly. Here you can see the technician pushes the camera all the way against the eye, directs the patient where to look, has them blink once, and then captures the image. Now we will show you how to take slit lamp images. All of the techniques you just learned still apply to taking slit lamp images, so the most important thing to learn is how to position the slit in order to view the parts of the eye. So to take the slit lamp, we want to center in on the eye. You can see our beam of light should be on the right side of the pupil so that we see it crossing the entire eye. Once it's centered, we can take the image. So if we're here, the slit is not in the eye, we're going to push forward until the slit is going through the center of the pupil. Thank you for watching this video to learn to take pictures of the eye. Taking clear images will allow the ophthalmologist to provide high-quality care for these patients.